Apollo Therapeutics is a biopharmaceutical company, and very simply, we take the best science from some of the world's best universities, leading universities, and turn that into new medicines. And we do this at scale. We build and operate quite a large and diversified portfolio of potential new medicines. That's very important for us. I think, as everybody knows, there's a high attrition in the activity of creating new medicines. And by having a large and diverse portfolio, we can optimize a risk and reward. As a company, we are focused on three key areas: cancer medicine, autoimmune and inflammatory diseases, and also rare diseases. So at Apollo, we hope with our collaborators to change healthcare over a 5 to 10 year time frame. It takes that long to develop new medicines. We're working with some of the world's top scientists working on cutting-edge innovation. And as a result, all of our programs we're doing with our partners, such as King's Health Partners, are all potentially what we call first-in-class or best-in-class. And whilst it will take some time to get them into actual clinical use, we hope they will have a major impact on thousands or possibly even millions of patients over time. So patient centricity is what drives us at Apollo Therapeutics. It is about obviously developing medicines that will be truly beneficial to patients. And for us, that means working with the end state in mind. So we work with cutting edge innovators and frontline clinicians, and thinking always backwards from how would a new medicine actually need to be used to actually be beneficial to patient healthcare. And we work backwards, and we're obviously working back 5 or 10 years, but we have to work with the end in mind. And that is a central part of our culture for patient centricity. Well, the story behind our collaboration with King's Health Partners starts at the beginning of this year. As a company that is focused on taking the best science from the best universities and turning that into new medicines, we really did want to partner with King's Health Partners. So King's Health Partners contains some of the world's top teaching hospitals, and with King's College London also is Europe's largest medical school. So we really wanted to be associated with King's Health Partners. It is a phenomenal innovation ecosystem for biomedical science, operating at great scale, and that fits very well with us. And so we approached King's Health Partners, and there was an immediate meeting of minds. And we could tell that King's Health Partners and King's College London, who drove the collaboration, are very entrepreneurial. It happened in weeks or in a month or so, quite unprecedented speed. And clearly, we knew we were dealing with a team. They want to get something done, they get it done. Working with King's Health Partners brings some clear benefits. As a very large and very esteemed biomedical ecosystem, innovation ecosystem, what we find at King's Health Partners is a tremendous group of clinician scientists or academic scientists who work in the NHS and in academia, and who are very well placed to come up with new ideas, new innovations that are likely to benefit patients, and also help us actually do the translation so that they actually can be developed to bring new products that are likely to be relevant to healthcare. So the work we're currently doing with King's Health Partners is focused around 4 key collaborations. And these have been put in place really quite quickly since starting the collaboration at the beginning of the year. And we're focused on cancer. We have a program looking at novel radiotherapy approaches to cancer, to highly targeted radiotherapy. We have a program looking at vascular homeostasis, which is going to be important in treating and possibly even preventing atherosclerosis, the cause of major vessel disease like heart disease. We have another program looking at epithelial membrane barrier integrity, which is important in inflammation, particularly asthma. And we also have another program looking at the immunology of autoimmune damage in transplants, so hoping to improve the success of transplants in the future. So how does our work help the NHS staff and wider the healthcare community around the world? Well, in the short and medium term, we provide a channel to take innovative ideas from leading clinicians and clinician scientists at King's Health Partners and translate that into new medicines. And that's something, that expertise we bring alongside the great innovators at KHP. In the longer term, we hope to provide clinicians and wider healthcare staff with novel therapeutics to better treat their patients. Now, hopefully that will benefit patients at King's Health Partners, but also globally. So how can clinicians and scientists at King's Health Partners work with us if they have ideas to bring them through to fruition? Well, that's very easy. So we have a very strong collaboration, and it's directly through King's College London, but obviously that encompasses King's Health Partners. And any clinician or scientist who has an idea can approach the technology transfer office at King's College London, and they can put you in direct contact with us. Also, our website, apollotherapeutics.com, gives you very easy to get hold of us. We are responsive. One of the things that we strive to be is to be a highly nimble and responsive organisation. And if an idea isn't going to work for us, we try to give that feedback very quickly. Perhaps larger organisations can be a lot slower in their interactions with academics. We try to actually be very nimble and to work very quickly. But I would encourage anybody with ideas for new therapeutics in the wider King's Health partner community to approach us, and we'd love to talk to you.